We are going to be doing an MCL sprain of a collegiate soccer player. My name is Angelica.
My name is Hannah.
My name is Sela.
My name's Adam.
And my name is Cass.
And we are all TLU students.
Yes.
So more about our patient information is that it is a collegiate soccer player, like Angelica said, and it is a subacute phase of an MCL sprain.
So first we're going to be talking about range of motion exercises. In our first exercise, we're going to be doing wall heel slides. In this exercise, gravity is used to make this a passive motion, and this increases range of motion without having to use resistance or weight bearing. In our progression, we will be progressing to chair pulls, and this is adding resistance. Doing this aids in the increase of range of motion for activities of daily living.
For our strengthening process of the rehabilitation, we would do lunges to help strengthen the muscles that surround the MCL to prevent the valgus varus force that caused this injury in the first place. We first start off with the standing lunges to prevent any added stress and start off easier, and while providing a close kinetic body weight exercise. Then we progress to walking lunges, which would further strengthen the muscles and add for a more practical strengthening for ADLs like squatting, walking upstairs, something like that. And then we'd also use the SAID principle to impose more demands to increase hypertrophy and increase strength.
We then move on to flexibility, and we start with passive hamstring stretches. This is a form of strengthening of the supporting ligaments that surround the MCL, and while doing this passively, we eliminate gravity and further strain on the MCL. We then progress to PNF stretches, and we have the patient push against the clinician actively, which minimizes stress in the MCL while also strengthening it. These stretches aid in lubricating the joints while also aligning scar tissue within the knee.
So for neuromuscular control, our first exercise that we did was a half squat, and this allows for the patient to limit their range of motion to what is comfortable, and this also helps with preventing further pain or strain to the MCL. And for our progression, we will be progressing to a full squat, and this increases the stability on the knee on a stable surface, which then allows for progression to unstable surfaces, and this also activates the muscle spindles, which allows for the patient to increase their dynamic stability within the knee and MCL, which helps the main goal of neuromuscular control.
So for balance, we start with the single leg balance, and then we will progress to single leg balance while passing the ball to the clinician. This can also be further progressed by using a foam pad for the patient to balance on. This exercise will help reduce the instability of the joints, and it can help maintain the center of gravity, as well as increasing proprioception and movement coordination.
Next, we're going to be doing leg extensions and then progressing to weighted leg extensions in order to cover our open kinetic chain activities, which allow us to improve the strength and function of the specific muscles surrounding the MCL. By eliminating factors such as body weight, we allow the patient to focus the entirety on the isolated muscle group that surrounds the supporting MCL in order to strengthen it. For our closed kinetic chain activities, we're going to be doing lateral lunges and progressing to walking lateral lunges with a TheraBand based on patient choice and pain levels. The closed kinetic chain causes a co-contraction of opposing muscle groups, and the exercise progression allows the patient to integrate balance within the joint, leading to increased strength and dynamic stability.
Dribbling and passing the ball would be some of the functional activities that we could do for this part of the rehabilitation process. The main goal in functional activities would be to take the mind off of the injury and focus more on the task at hand and get them into more sports-orientated activities. So this would be combining many parts of the rehabilitation into one, and also the patient would be put in a pre-injury state so they can improve their overall function. And there's also a psychological effect that goes along with this to help them gain confidence that they can get through and work with this injury and progress in the sport.